Okay, so this will be head and neck draping, so when we need access to the face or potentially the neck, depending on where we place the ENT split sheet. So first drape is going to be what we call a head drape sheet, so you can hand this to the person that you're draping with. You're gonna see it looks kind of similar to the top sheet of the universal draping, so we would pull off this adhesive, okay, and we're gonna stick that down right around the patient's hairline, because of course, if we do not need access to the hairline, we want to wall off the hair because it's a potential source of contamination. Ohowever, you do need to be aware if your incision site is going to be, say, for like a facelift up into the hairline, you want to make sure that this would be placed back far enough that you're not going to occlude the area where you're going to be making the incision. And then we have our ENT split sheet. So again, you're going to look for the picture or the diagram of your person. So head towards the head, foot towards the foot. Again, we always hand a drape so that the fold is down. So you're going to hand it to the person that you're draping with. We open it up. We're going to go to the feet first. So we cuff our hand and go out over the foot of our patient. Now this is a split sheet. So remember, on a split sheet, you're going to have the tails where you pull them back. You're then going to pull the adhesive. So remember, on the adhesive, we always pull from the top down so that we don't pull this direction and then come back and end up contaminating something. So hold on. You're going to switch hands, grab on the inside of the drape, and then stick it down. So if I was working on the face, we would place the split sheet approximately here, but if I needed access to the neck, we would make sure that we hold it back further, giving us access to wherever we're planning on making our incision site. Okay. So some surgeons may use what we call as a turban. Okay. So on that, instead of utilizing the head drape sheet, they would utilize two towels that are open on your back table. We have those open to this direction. Now your anesthesia provider is going to be the one that lifts the patient's head, so we'll assume Laura here, who is my surgeon, will say she's the anesthesia provider. So you're going to lift the head, you're going to slide the towels underneath, they'll put the head back down, and then you just grab the top towel and you're going to bring it up around the patient's hair and just secure it up this direction. Now this seems to be a very small towel, but we would then just secure it with a perforating towel clip. It's not a very pretty turban here, but just something that comes up and around, and then they could potentially use the split sheet that would then come up as well. Just another way to occlude the patient's hair and keep it from coming up and contaminating the incisional area.